hospitals for oncology. A warm welcome to Dr. Sapna Nangia, Dr. Naveen Hedne, Dr. Sandeep Dura, and Dr. Aarti, and all my fellow colleagues. It's an important day today because we are launching this comprehensive clinic. And as it was pointed out, it is important. We have seen survivors in head and neck cancers, post their treatment, they have to face a lot. And what we have found out, they have a lot of difficulty in breathing, sometimes in talking. Speech also takes a problem. And that's why we at Apollo Proton Cancer Center thought we should come up with this initiative. For us, rehabilitation matters and recovery matters. For us at Apollo Proton, treatment ends, care begins. And that's the idea why we feel we should be going in for a clinic like this. C-VASC brings together specialists across oncology, ENT, so that patient gets everything under one roof. By combining advanced diagnostics, innovative treatments, dedicated rehab support, we aim to help patients reclaim essential functions. Importantly, the clinic will also serve as specialized center for professional voice care, supporting singers, dubbing artists, and broadcasts. This initiative is another step in Apollo Proton Cancer Center's journey of redefining cancer care. Thank you once again to everyone who's present here for being a part of this initiative.
And thank you all for joining today. I think as Karan pointed out, it's a very, very important day for us. And we actually are committed to making sure that the patients who come to us for treatment, not just go back well, but they go back thriving. So they go back and do whatever they wanted to, and that is our commitment. So today I was not expected to be here, but I just lined up, so I thought that I must take this occasion moment to thank you all, that because whatever we do, unless it goes out in the public, it's communicated well, and the people believe in that the real uptake doesn't happen. So I think you play a very important role in taking this message that cancer today has come a long way. While on one side the numbers are growing, but the other side the treatments are growing better. And we have more and more modalities of treatment, and therefore the questions of better quality of life are more alive than ever before. And that is why that is at the center of all that we do. And it's a combination of teamwork, as pointed out repeatedly, that today healthcare is a team sport, and oncology is the apex of that. It's the ultimate pyramid. There's nothing as more complex which requires so many people to come together and deliver to one patient at each touch point. So that is what we are committed to. And once again, thank you, Karan, and thank you, team, for being here. Thank you.
Yeah, very nice to see all of you here. You'll have to excuse me. Nan Tamil katkren, ana fluency illai. So iniki English pesuven. So let me just explain that head and neck cancers are the most common cancer amongst Indian males. They require our complete attention, and focus to improve the results and improve the quality of life of patients. So not only do we want our patients to survive longer, we want them to survive longer cancer-free, and we want them to live their life, they all have a role, right? They have a role in life. That role could be of a parent, of a spouse, of somebody who is a breadwinner, somebody who's a student. So we want them to go back to their role in life. And when we want them to go back to their role in life, then all the functions, whether it is presenting themselves to society, talking, eating in public, eating with their family, each of these things is very, very important. Very often, when patients are treated for head and neck cancers, we ask them, are you able to eat at a wedding? Because that is critical. In India, a wedding means slightly spicy food. It means maybe something which may also be crisp or slightly pointy. So are you able to swallow that? Have you recovered your swallowing functions? These are all the finer details that ensure that a patient has made full recovery after treatment. So as you know, Apollo Proton Cancer Center is the first proton therapy center, not just of the country, but also of South Asia, Southeast Asia, and Middle East. It has been our privilege and responsibility to bring this technology into the country and to improve the quality of life of the patients, to improve the outcomes. That is what we have seen, and that is some result we are presenting in Astro a little bit later. In September in Boston, we are presenting the results of our experience at the Apollo Proton Cancer Center of improved quality of life, better quality of life, and better outcomes. We have many firsts to our credit. One of them is, of course, proton therapy, but we also there are very few dedicated cancer management teams, but at the Apollo Proton Cancer Center, we have dedicated cancer management team, and today you will be meeting the head neck cancer management team. When we talk about head and neck cancer, there are other things besides proton therapy or good quality radiation, like surgery, reconstructive surgery, transoral robotic surgery, personalized systemic therapy, and all these are something that we strive to provide to our patients at the Apollo Proton Cancer Center. Now, a special mention about voice and swallowing preserving treatments. You will be hearing Ms. Aarti Soman, our swallowing and speech therapist, who will be talking about this, and then of course my colleagues in the head and neck surgical branches who will be discussing what we do here. As a radiation oncologist, I'm really happy that voice preserving treatments have been, radiation has been an integral part of voice preserving treatments. So for laryngeal cancers, for hypopharyngeal cancers, when we give radiation, and if for advanced disease, when we give radiation with chemotherapy, patients are able to avoid surgery in most situations. And that is, again, a very satisfying thing as a head neck oncologist, that we are able to cure the cancer and maintain the normal pathway both for breathing as well as eating. That is, of course, one small component. There are many other components of prehabilitation and rehabilitation, and today we have gathered here to understand how these can improve the life of patients and how the C-VASC clinic will be a concerted effort to do so. Thank you once again for being here.
Namaste and a very warm afternoon. Today I'll be talking about the Comprehensive Voice Clinic, but before that I would like to give you a brief on what does a voice box do. So basically, breathing, speaking and eating are basic functions in a human. So any of these qualities, when affected, it impacts our quality of life. So in a head and neck cancer patient, about 80% of these patients have one of these functions or multiple of these functions affected at any point in their life. Voice, airway and swallowing, they all are interconnected because they are all having similar structures playing their roles are being divided into the same structures. Now in a voice box, what does it do? So it opens and it closes, as in this seen in the picture. It opens and it closes when we are speaking, we are eating and we are breathing. So the main function of the voice box is preserving the airway, because when we eat, when we swallow, there are possibilities of the food particles to enter into our airway, which we generally perceive as choking. And also the secondary function being sound production or the voice. Now what are the signs or symptoms, or how does the patient come and tell us that they have difficulties? So when a voice patient come to us, they generally have complaints of hoarseness of voice, strained voice or weak projection in the voice, and breathiness or complete loss of voice. When an airway is having a trouble, they usually complain about shortness of breath, chronic coughing, wheezing, noisy breath or stridor, and recurring choking sensation. In case of a dysphagia or difficulty in swallowing, generally the complaints are pain while swallowing, food or liquid getting stuck, throat clearing frequently, coughing during meals, and nasal regurgitation. Now, what are the causes of all these problems? Majorly, the voice, airway and swallowing complaints can arise in head and neck cancers, neurogenic disorders or tumors, structural obstruction caused by benign growths, and inflammation or reflux. In a head and neck cancer, generally these problems can be impacted upon presentation when the tumor shows itself or as part of a surgical procedure or while undergoing the treatment or as part of post-treatment. So in the pictures you can see some of the tumors. These tumors can impact the closure of the voice box, impacting the voice or breathing and swallowing as such. Commonly in head and neck cancer, the tumor location is very important when we are deciding on how to intervene or how to manage the problems. So tumor location, generally when it comes to a voice box tumor or somewhere in the throat, majorly impacts the swallowing function and also airway. The problems with tongue, when the tumors are around the tongue or the back of the tongue or anywhere in the oral cavity, they have a bigger problem when it comes to the speech. Now the surgery actually impairs or changes the structure of the oral cavity or the throat. So that can also have an impact in the swallowing function. Now radiation and chemotherapy, as ma'am mentioned, we are having advanced radiation and chemoradiation. So most of the patients have some amount of edema or swelling that can impact from the treatment, which can cause some amount of airway problems or swallowing dysfunction. Who is a professional voice user? So professional voice users are people who use their voice for their career. Now they are basically singers, actors, dubbing artists, news anchors, attorneys, radio jockeys or call center staff. So a voice health is basically critical for these people when it comes to their job. Now what are the problems we see in a professional voice user? Generally, vocal abuse is the most common thing that we see there. So they would have used their voice little too much or too louder, which would have caused this problem. Vocal nodules are small bumps on, as you can see in the picture, the small bumps on vocal cords that can impact their voice. Vocal fatigue from inappropriate use of their voice, either by shouting or clearing the throat frequently. And laryngitis. Laryngitis is nothing but inflammation around the cords. Now, how do we diagnose these problems? So basically, the diagnosis comes through multiple things, but these functions are assessed using a fiber optic or flexible laryngoscopy, which involves putting a flexible camera through the nose and seeing the structures within. A video fluoroscopic swallow study, which involves a moving X-ray being taken when the patient or the person swallows something contrast-based. The third and the most important thing when it comes to a speech and swallow therapist like me is a patient-reported outcome measure or PROM. These help us in identifying not just the problem, but where exactly is the problem lying in. Basically, which aspect? Is it emotional aspect? Is it the physically, the process of eating or breathing or speaking that is the problem? Or it is more to do with the social etiquette of this patient. Treatment. Now, vocal hygiene or preserving the vocal health by using lifestyle modifications is a very, very important aspect which we generally use in Apollo Proton Cancer Center for all the patients who come to us. So the next is the therapy part. Therapy part generally involves identifying the problem and giving them small exercises with regard to voice, swallowing and airway. Medical or surgical interventions, which generally can range from as simple as a reflex medication to minimally invasive surgeries or larger surgeries. Radiation and therapy, as ma'am mentioned, there will be whichever organ preserving technique that has been used for. So, in cancer center, basically many of these cancer patients, they just walk as survivors. But most of them have altered quality of life. Generally, they have difficulty either while speaking, while eating, or in general, they have a limited energy to go around with, for functions and other things. So some, they don't even know that there is something called as rehabilitation that happens after the treatment. So we at Apollo Proton, we believe that not just surviving is sufficient. We have to aim at betterment of the quality of life. So hence, we came up with the idea of a comprehensive voice, airway and swallow clinic. So we are making them choose from silence to the strength. So the aim is to improve not just cancer survival, but better quality of life. Now, this clinic offers a complete care for voice, airway and swallowing difficulties arising not just from head and neck cancers, but other neurogenic problems or a professional voice user too. Now, at Apollo Proton Cancer Center, what do we do in the clinic? The major or the most unique aspect of C-VASC is prehabilitation. Prehabilitation is nothing but intervening a patient even before the treatment begins, so we can identify on what aspect is the patient lacking in. Is there some amount of anxiety? Is there some amount of social disturbances that arises because of the presence of the cancer? Or is it something to do with their voice, their speech, their airway or swallowing? Now, we have a multidisciplinary team, as mentioned by people before me, so which provide holistic care. So, and we have a joint clinic and counseling sessions which will be provided by the clinic so that the patient is ready for the treatment even before it commences. All the treatment through the C-VASC are individualized and customized for the patient. We also are inviting all the professional voice users who have difficulty for the problem. So, thank you.
Who have put up a great effort, put up a lot of effort to put this show. So I would be happy to announce the launch of C-VASC clinic, that is a comprehensive voice, airway and swallowing clinic. We all know that human beings are special because of the ability to speak and communicate, whereas in the rest of the animal kingdom, most of the animal kingdom, the purpose of voice box is to only prevent food from going into the lungs and choking. But human beings, we have developed a special skill to speak, communicate, which makes our identity and currently where we stand. So not only face is the identity of a person, voice is also identity of a person. So when a patient, when somebody loses their voice, I don't like to say patient, when somebody loses their voice, they lose their identity. So it's very important to convey that when we treat somebody who is suffering with cancer or any problems with the mouth or the voice box, can be treated with minimal effect to the voice, which can help them to overcome and get back to the normal and get their identity back. So World Voice Day is celebrated on April 16th of every year. So this year the focus is caring for our voices. So it emphasizes on daily usage of voice, which is very important for everything we need to speak. Second is professional voice users, how to look after special professional voice users, their voice, and also to develop research and propagate voice health or vocal health. This World Voice Day celebrated every 16th of April. Next is airway. Airway or breathing is means the most important thing in life. Without breathing, we don't exist. Third is swallowing. Swallowing is not just an act like some animals like snakes swallow the food, but for human beings, swallowing is not just an act. The thought of swallowing results in secretion of saliva. There are a lot of nerves involved in swallowing, a lot of muscles, up to 50 muscles are involved in swallowing. It's a coordinated effort. So whenever there is a tumor or a cancer in these areas, there will be some effect on all the three aspects, that is voice, airway and swallowing. So that is why the concept of this C-VASC came up. So when we treat as a surgeon or any of these cancers, we always whenever there is a need or requirement of surgery, we remove the part of the tumor along with some normal tissue, which may affect the ability of a person to speak, eat in public and communicate well. So how do we minimize this? With something like minimally invasive surgery, we try to reduce the effect of this treatment so that patient can get back to their normal eating, at least whatever, not everything, but to a satisfactory level. Speak, publicly speaking, because a lot of these patients are in the prime of their age where they're still working. So any effect on their voice, swallowing can give them social, psychological and economical distress. So we need to, whenever we see these patients, we need to make sure that we give them least morbidity. So we incorporate robotic surgery, we incorporate reconstructive surgery, where if we remove a part of tongue, we replace that part of the tongue with some tissue. Tongue is one of the most difficult organ God has created. We cannot recreate a tongue, but we can take some tissue and give that volume or can replace that so that patients can speak and eat as good as others. So what is the importance of this C-VASC clinic is most of the centers have all these aspects what we are talking about. Here we are empowering the speech and swallowing therapist to lead the this C-VASC clinic, where because they interact more with the patients, they have the patients also tend to speak to them more, and they can see them before the treatment begins, during the treatment and after the treatment, so that they know what is their journey through this treatment, so they can get the best desired outcome. So we are focusing not only on cure, but care beyond cure. So I would like to send a message to the public that treatment of these head and neck cancers, oral cancer is possible with minimal or acceptable problems with speaking, eating. So that because most of the people delay treatment because the fear of going, oh, they will remove part of my tongue, they remove my jaw, they remove my voice box. So they allow the cancer to grow and become bigger, which will make the treatment more difficult and recovery later. So we urge or we request, we want to send a message to public, whenever there is a problem, overcome that fear. It is treatable. These cancers are treatable with minimal effects if detected early and treated well with the comprehensive plan. Thank you.